Martena McKenzie, and her presentation will be a retrospective review of the sensitivity and specificity of chest X-ray in the detection of tuberculosis in asymptomatic individuals in Guyana. When you're ready, you have 50 minutes and you may begin.
Good morning, fellow students, lecturers. My name is Martena McKenzie, and this morning I'll be presenting my research proposal to you all. The title of my research is the Retrospective Review of the Sensitivity and Specificity of Chest X-rays for the Detection of TB in Asymptomatic Individuals in Guyana. Now, pulmonary TB remains a scourge in today's society, especially in developing countries, with Guyana being no exception. This is so because of the lack of effective diagnosis and treatment of the disease. Now, according to WHO, every second around the world, a person is being newly infected with TB, and about 1/3 of the world's population is infected with latent TB. Now, as you may know, there are two forms of TB. You have latent TB and active TB. Now, the one that goes sometimes undiagnosed is the latent TB, because this is where persons have the infection, but they show no signs and symptoms of the disease until, well, it is easier now when they have this latent TB for them to acquire the active TB, because when their immune system becomes compromised, they can quickly develop it. Whereas with active TB, the person already have all the signs and symptoms and possess the TB disease, and that's where they can easily pass it on to others. From that, you can know that, well, yes, this person has TB because they show all the signs and symptoms. Now, WHO's vision is to end the TB epidemic by 2030 and have it eliminated by 2050. Now, in order to do this, to effectively fight the TB disease, accurate identification and treatment of both latent and active TB is vital. Now, the problem is, normally chest X-ray is the most commonly performed radiographic examination in the imaging department, with detection of TB being one of the most frequent referrals. Now, without verification of the efficacy of the diagnosis of latent TB, it can often lead to misdiagnosis, unnecessary radiation to the patient, high cost to the health sector. The goal of my study is to determine the prevalence of chest X-ray at the Georgetown Public Hospital Corporation and its effectiveness in the diagnosis of latent TB. The aim is to verify the efficacy of chest X-ray being used as a routine screening test for latent TB. Objectives are to determine how often chest X-ray is being done in the imaging department of GPAC, and to investigate reasons why persons would have a chest X-ray done, and to investigate the usefulness of chest X-ray for the screening of asymptomatic individuals for TB. My hypothesis is there is no significant difference between the use of chest X-ray for diagnosis of TB among symptomatic and asymptomatic individuals. My literature review. From the literature, it was revealed that TB is one of the leading causes of death worldwide, especially in low and middle income countries. Now, in 2014, there was an incidence of 9.6 million persons who developed TB, 1.5 million TB deaths, and the incidence of latent TB being 23%, approximately 1.7 billion. Now, the amount of lives saved between 2000 and 2015 was 49 million, and this was done through effective diagnosis and treatment of the disease. Now, WHO fight against this TB epidemic, and to end it by 2050, they have developed specific targets for 2025 and 2035. Is to reduce the deaths to 75% and incidence rate to 50% by 2025. And by 2035, have a 95% reduction in deaths and 90% reduction in incidence rate. Their strategy include patient-centered TB care and prevention, early diagnosis of TB through systematic screening of contacts and high-risk groups, treatment of all people with disease, and vaccination against TB. Now, as we all know, chest X-ray is the most widely used screening tool for diagnosis of TB and evaluation of many thoracic abnormalities. These studies, this is just 3 studies that were reviewed using from asymptomatic or just say healthy persons. The first one was done on students entering into university. This was done on 3,859 students. From these, the results show that there were 97% of these were normal, while only 0.3% were abnormal. Of the abnormal cases, only 4 were pulmonary TB. The second case were done with pre-employment persons. Was 4,113 individuals had chest X-rays done. 95% of 0.1% of these were normal, and only 4.9% were abnormal. Of these, again, 4 cases had pulmonary TB. The third case is with adopted children, where 1,598 cases were reviewed, and 92% of these were normal, 8% were abnormal, and of abnormal cases, only 8 were positive for TB. Now, from all of these studies, they conclude that chest X-ray is not useful for the diagnosis of asymptomatic persons for TB. Another study done in China between 2006 and 2008 revealed that there was a high prevalence of tuberculosis among asymptomatic HIV positive persons. The evaluation was done checking the sensitivity and specificity of three screening methods: chest X-ray, sputum smear, and sputum culture. And it was revealed that chest X-ray had the highest sensitivity but the lowest specificity for TB, whereas sputum smear and sputum culture had the highest specificity and lowest sensitivity. Now, several studies also agree that physicians should discourage the use of chest X-ray as a screening tool for asymptomatic persons, since it adds little to the outcome of the patient, it is not cost effective, and it can cause unnecessary radiation to patients. Now, my study design will be a retrospective case control study that will be carried out at the GPHC, and data will be collected from patient records over a 5-year period, 2010 to 2015. A random sampling technique will be used for the selection of these patient records. The sample size will be 96. This was done using the population sample size, and we came up with a sample size of 96. Analysis of the data will be done using ANOVA. The mean, mode variance, and standard deviation will be calculated along with correlation coefficients. Bar graphs, line graph, and chart will be used to represent the data. Now, from the study, it is expected that asymptomatic persons' chest X-rays will be negative for TB, and not all persons with signs and symptoms of TB chest X-rays will be positive. This is a timeline from my study. The codes in yellow are tasks that have already been completed, green ongoing, and red tasks that will be yet to be completed. This brings me to the end of my presentation.
Okay, thank you very much. And you have 7 minutes left. That means that you've done it in 8 minutes. You have now 5 minutes of questions beginning now.
Okay, so I have a few. First of all, can you start by explaining the difference between specificity versus sensitivity?
Okay. The sensitivity is the ability of a screening test to accurately identify persons that have the disease, whereas specificity persons that do not have the disease.
Are no presenting symptoms or directly stating them? So one goes in a positive direction and the other one goes in a defining that they do not have.
Yes. Okay. Let's say someone comes with symptoms of, let's say, cough or whatever, the symptoms of and you using a screening test. Sometimes that symptoms might not be of TB to somebody else, but using the screening test that is very sensitive or specific will tell you either if they have it or not.
I know what I'm trying to get is what's the difference then between using specificity and using sensitivity?
Somebody might know that this person don't have this TB because they do other tests other than the test that you're using. So you know for sure that this person don't have this little TB. So we use that.
So it's basically determination by elimination using auxiliary tests
Yeah,
to
you can,
confirm that
because
your principal test
like
is
with TB,
working?
for latent TB, for example, from the studies that, well, we show that is not a good screening tool for latent TB because, of course, you don't have the signs and symptoms, whereas they have all the screening methods that you can use, and then you use just X-ray just as a verification. So,
Which is why you said that chest X-ray is what you commonly use for latent TB, right?
yeah.
So what I was going to ask with what you found in non-latent TB, what's the term you use for symptomatic TB with presentations?
Asymptomatic meaning latent, you don't have no signs.
Right, so symptomatic, right? What would be specific markers on a chest radiograph, for example, be to tell you whether a patient presents with latent or asymptomatic versus symptomatic on the chest radiograph?
Well, I will be exactly looking at the radiographs, I'll be looking at the charts, well, the patient record. Well, from the, you know that the data chest X-ray, they will have a card, they will say they have symptoms or not. And from the report, you would have diagnosis. So that
So you
would
will be
be
looking for a specific like key terms or so that would have been used in analyzing the
the
chest
symptoms,
radiograph
from the symptoms, the terms for the symptoms.
from the chest radiograph. According to your study, I'm getting the impression that the chest radiograph is going to be your main tool. Is that correct or incorrect?
Yes.
So if the chest radiograph is going to be your main tool, at no point in time will you be actually evaluating the chest radiograph?
No, because I'm not trained in that area to evaluate, so that's why I'm looking at the records, the patient report from what the doctor has.
So you're looking at the analysis of what the radiologist has presented
Yeah.
and not the regular,
Not
the
the
GMO. So you probably needed to specify that you're actually going to be looking at the radiologist report versus the GMO's report.
Well, it can be either, because sometimes we don't have only,
Only the radiologist is authorized to write your report. So it's kind of.
that was one of the things that came out in the review where that some regular doctor would be able to analyze the radiographs.
They're allowed to analyze because they have to look for findings, but in terms of confirmation of diagnosis, I think it would give more legitimacy if you confirm that by using a radiologist report.
Yes, well, that's.
Which is what I was leading to by asking you what on the chest radiograph would point you to directly saying that, okay, this was confirmed for asymptomatic or symptomatic presence of it. Right. So basically, I just needed a little bit of clarification in addition to that. The specificity versus sensitivity issue, because you mentioned it a lot in your presentation, and it seems to be a significant tool in aiding you to carry out your analysis. So probably we needed to understand a little bit more on the difference between.
All right, thank you very much. You have 8 seconds, so I'm not going to ask you this question, but I think your hypothesis needs to be clarified. I will address it by email. Time is up.